Thank you. My name is Dr. Pam Popper. I'm from Wellness Forum Health in Columbus, Ohio, and I thank you for the opportunity to talk to you today. We've been in business for almost 25 years, and we've worked with about 100,000 people who have contacted us because they want to regain or maintain their health. Most of these people have chronic degenerative conditions like type 2 diabetes and coronary artery disease. We've seen a couple of really disturbing trends. One is lower and lower ages of onset of disease. We have second graders with type 2 diabetes, high school kids with rheumatoid arthritis. And of course, the population's getting fatter and sicker. It's rare to see a normal weight person in our office today. Poor diet's always a contributing factor. It's often the thing that has caused these people to be sick. Most of our people have eaten a diet high in fat and protein, too much animal food, too much dairy, too much processed food. We standard procedure in our office. We put these people on a low-fat, high-fiber, plant-based diet, and they get better. In fact, they get better so quickly that they have to be medically monitored because the drops in blood pressure and glucose levels mean that medications have to be reduced and sometimes withdrawn within a few days. One of the most common things that people ask us at the end of this process is, why didn't I know about this? They tell us routinely, I would have converted to this diet if I knew I could have prevented diabetes, and I certainly would have done it if I thought that I could have reversed my disease. So why aren't we telling people this? Well, there's a lot of confusion about diet. Some of it's been sowed here. People advocating high-fat diets, and I personally take offense to anybody who would come up here and say that the dietary guidelines are a joke. That's my opinion. I think it's offensive. But if you take a look at high-fat diets, low-carb diets, the measurements short-term show that the benefits are there. People lose weight and their numbers come down. But if the only thing we're going to do is consider short-term benefits, there are a lot of things that cause people to lose weight and have good biomarkers. One's cocaine addiction. I've never had a fat cocaine addict in my office, and I've never had one with high cholesterol or high fasting glucose levels. Now, I'm being facetious, of course, but the point is, if the only thing that counts is short-term, a lot of things are short-term good, bad in the long term, because it takes a long time for cancer to develop in response to a high-fat diet, for example, or a high-protein diet. A plant-based diet, low in fat, high in fiber, is the one consumed by the healthiest people on the planet, like the Okinawans, who didn't get the memo that high-carb, starch-based diets are bad for you. So I strongly encourage the committee to take a very strong stance on this issue and recommend a whole foods, plant-based diet. Thank you very much.
Be sure to hit that subscribe button for more highlights and information about the changing dietary guidelines in 2020, an exclusive analysis you won't find anywhere else on YouTube. And make sure to hit that notification bell too, so you don't miss the next video. Y'all know what time it is. Red Pill Vegan. Next.